Now, Medicaid expansion is a big issue here in Missouri. Senator Roy Blunt was in town today, and when they're here, we love to invite our lawmakers to join us for what we like to call straight talk. Thank you so much for joining us, and it's finally great to meet you. We're going to get straight to it. Governor Nixon wants Medicaid expansion, but Republicans don't. Why?
Well, you know, I'm not in Jefferson City, so I don't have a lot of advice on this, but I think it's a legitimate thing for the legislature to be concerned about. That money has to come from somewhere. And even though in the early stages there's 100% paid for by the federal government, that doesn't last too long, may not last even at the 90% level as long as they think. And so every time you raise one of these programs, you have to get that money somewhere. The state, unlike Washington, can't just print money. And we see what happens, the problems of printing money to the tune of now $17 trillion in debt in Washington. So Washington's not the example here. But by the way, welcome to Springfield, and we haven't had a chance to meet since you got to my hometown.
Definitely. Well, nothing has caused more division in Washington than the Affordable Care Act. Mainly the Affordable Care Act. So what's the answer here? Should we scrap the plan and start over? What do you think about that?
Well, I think the best thing would be to start over again, and based on what we know now, this would be a much better debate than the country had in 2009. I think people understand what's at stake, the health care providers understand what's at stake, and the Congress at a level that they didn't in 2009 understand what's at stake. I was in the House still in 2009. One of my jobs at that time was to come up with the alternatives, like expanding high-risk pools and buying across state lines and letting people stay on their parents' insurance longer, some of the things that got incorporated into the bill. But I said more than a couple of times during that, you know, if by the time we're done, all the members of the House just know the difference in Medicare and Medicaid, we'll have taken a big step forward. Kind of joking, but all the members now know the difference, and I think they also know how serious this is, just like the people we work for do. Starting over would be hard to do. It'd be the best thing to do, but this clearly is a system that the way it's currently configured isn't reaching people like the president had hoped, and has lots of workplace consequences. People that have fewer than 50 employees don't want to be covered, so they don't add employees. All kinds of people have gone on the part-time instead of the full-time work roles since this bill started, because for the first time ever, the government said who you had to insure, which meant there were also a number of people that apparently you didn't have to insure.
Yeah. Well, the other thing we want to talk about is your mental health care bill. A lot of it kind of came from the Sandy Hook school shooting. Can you talk about that?
Well, you know, I think what that did was call attention to something I've been interested in a long time, which is why we don't treat mental health like we treat every other health problem. When the tragedy happened at Sandy Hook, the Senate committee that deals with health had a hearing the following month in January. It was the first hearing. That was January 2013. That committee hadn't had a mental health hearing since 2007. For whatever reason, Jennifer, this is just something that we haven't deal with as a society. The military now understanding how important it is that they deal with it, and I'm involved in that too. And I don't want to say we talk about Sandy Hook too. The one consistent thing in all these tragedies, there can be different weapons, different locations, different kinds of victims. There's always somebody with a mental health problem that hasn't been dealt with. But the people with a mental health problem more likely to be the victim of a crime than the perpetrator of a crime. But for whatever reason, we need to look for the opportunities we have to get back and look at mental health like we look at all other health. The National Institute of Health says that 1 out of 4 adult Americans has a diagnosable and in almost every case treatable mental health problem. And we need to treat that problem like we treat every other health problem. And we were able to get some legislation passed this year that creates in 8 pilot states the opportunity to do that at behavioral health clinics.
All right, Senator Blunt, thank you so much for stopping by and talking with us, and it's finally great to meet you.
Good to meet you.
Have a great trip. Okay.